Well, biocompatible materials, and there's different ways of finding which material. Bio just means life. Compatible means, what's compatible with life. So it means materials that would be most compatible to each individual person. So what they can do is they can actually take a simple blood test, and they can find out of over 10,000 different dental materials which ones they're reactive to and which ones they're not. And then I would only use the ones they're not reactive to if we're fixing their teeth, etc. As I've said before, if a person is going to spend thousands of dollars on their teeth, they might as well use materials that they're compatible with, because we have the technology now to do that. And that's what biocompatible, that's one aspect of biocompatible dentistry and materials. Well, for example, there's composites, which are sort of space-age plastic type materials, right? And there's hundreds and hundreds of different types and makers and different formulations involved in it. So those are the white colored fillings, for example. Then there's cements that we use to cement, a crown or a bridge, or even veneers get cemented on. So there's hundreds and hundreds of those types of materials. So it's, finding out which of those materials is most compatible, because they have slightly different chemical differences involved in them and compositions. Then there's porcelains. There's hundreds and hundreds of different types of porcelains. And then, of course, there's metals. Let's say in holistic dentistry, it's questionable. If a person's missing a tooth, do we use an implant or not use an implant? Well, if you're being holistic, I look at their history, their family's history. Is there a problem with cancer? Is there a problem with a lot of body issues and things like that? Then we might look at some alternatives. But if there's not, then what do we use? Do we use titanium? Do we use some of the others and their mixtures of metals, etc.? Well, those can be tested for. And that's the beauty of it. At least we're doing what's the latest that we can to help be preventative of a future situation.